Hi, my name is Rhoda Ngandu, and today I'll be talking to you about the Center for Disease Control and Prevention, the CDC's program known as the Public Health Associate Program that helps to source workers and train them for the public health workforce. So this training program is a 2-year stint. It's very competitive. Applicants have to have at least a bachelor's and be interested in working in public health in whatever capacity. Could be epidemiology, nursing, or even just research. And so this program has human resource management considerations such as selection, and also it's a paid 2-year program. So there's incentive and compensation going on there. And so this program has been pretty successful. Within the past 10 years, this program has recruited over 1,000 associates. And at program completion, most of the graduates from this program actually do end up in the health industry, usually 100% at program completion. But after several years, maybe 5 years, 3 years, the amount of people in the public health workforce do decrease. And so one of the questions that this program brings about is the issue of retention. And that was what my research project was really about, in trying to figure out how successful is this program in retaining workers within the public health workforce. So there's been some studies, most of them from 2010 to 2013, and some of the numbers that I found is that of the workers currently, right in 2012, there were 11,223 people working at the CDC. There were 10,316 who were working as civil servants outside of the CDC, and there were 907 working as commissioned corps officers federally. Of those, there were 61% consisted of women, and then 16% of the workforce were to retire by December of that year, 2012, and then 30% were eligible to retire by December 2017. So looking at those numbers of retirement and those, especially in the 2017, which was 36%, there's the issue of whether there would be good succession and good recruitment so that the gap of workers could be filled at that time. So in terms of job roles, most of the public health workers, most of them were nurses, 16%, and clerical positions of 19%. And then the rest of the job roles were environmental health workers at 8%, public health managers at 6%, and laboratory workers at 5%. So those job roles are the ones where there's most recruitment, as you can tell, with the clerical positions and then nurses. So those are the jobs that have been the focus in terms of the public health workforce. And so another thing to think about is how the CDC program is recruiting. And one of the things that I looked at was the website. The website is really packed with information about the program, especially testimonials, and not only written testimonials, but video testimonials, which I think is a really great thing for them to have, as you see the real life experiences that these associates had during their 2-year programs, and the differences that they were able to make. And so I'll segue into the website now, and then we'll conclude about this program. Thank you. So if you Google CDC Healthcare Associate Program, you can find the link to the CDC website, where they have information about how to become an associate or even how to become a host site. And one of the experience tabs here show you video clips of experiences of previous associates in this program. And one of the ones I liked is this one by an associate who actually was on a grant. And here we go.
One of the things that has surprised me the most about PHAP is that not only have I received phenomenal mentoring from both my CDC and my host site supervisors and colleagues, but that I've also served as a mentor to them. And as a young associate serving on a team that's working to combat the opioid epidemic, it's been really affirming to have team members that look up to you as much as you look up to them. And a great example of that is I'm a lead on a major grant application that we're currently applying for, and my team members look to me as not only a core member of their team, but as someone who provides them with structure and guidance.
So this is really important information about how the different experiences that all these associates have been like. Some of them, are not even from a background of public health, as you'll see in this one here.
I chose PHAP because I wanted to explore public health and I didn't know how to without direct public health experience. I was a double major in anthropology and communication, and I did not know that there was a place for social sciences within the public health world. And I was really happy to find out that there was, and that there is a lot of opportunity for us out there who are social science majors. And I can say that I've totally fallen in love with public health, and I just never want to leave it.
So I really think that they do a great job on this website in really advertising the opportunities that are there for people to learn, to really be engaged in public health and become part of the workforce. So, with regards to the question of why do people work in public health, studies generally focus on the job security and competitive benefits that the civil workforce provides. And in terms of attracting workers, those two factors, job security and competitive benefits, are also important to job retention, not just to recruitment, but job retention as well. And really, one of the things that comes up in public health is that people want to commit to a greater purpose, serving the community. And as you'll see in the testimonials on the websites, that's something that people really talk about their experiences within the 2 years, is being able to make an impact in their community. Also, one of the things that has been related to retention problems is that people usually leave within the first few years, and then also some factors, other factors related to wanting to leave within the next year have been shown to be being a person of color, living in the West, and having, like I said, a shorter tenure in one's position. So these are really critical things that need to be addressed. Is why are people of color not remaining in their positions for a long period of time? Why is it that people living in the West are also, don't have great job retention as well? And so those factors might need to be studied going forward, just to focus on those groups of people that have been shown to have low job retention. Another statistics that I wanted to point out is that with this program, the Public Health Associate Program, it's been shown that after the first year, the amount of people in the public health workforce decreases to 86%. The amount of graduates in the public health workforce decreases to 86% at year 1. And then at year 3, it's been shown to decrease to 68%. So this is a program that starts out with 100% of people being in public health at graduation, but over 3 years, it's decreasing by 32%. So that's something that really needs to be addressed, because if more people will retire, then we need to focus on the new graduates to have really extended periods of job retention. Yes, and so those are my recommendations for research going forward.